Good afternoon and welcome to the Health Automated podcast. My name's Jack White. I'm one of your co-hosts, and alongside me, like usual, my right-hand guy, Mark Tops. How you doing, Mark?
Yeah, not too bad, thank you. You?
Yeah, not too bad, not too bad. Another exciting week of half term. I do not remember this many school holidays when I was a child. Don't ask me why. Apparently they were there. However, we are nearly at the end of that week, which is great because back to normality next week. How's things been down in Essex, Mark?
Yeah, not too bad. You are right. I don't remember this many school holidays, and I think they're back to school next week. And I think there's probably only about, I think there's only like 7, 8 weeks, and then they're off for summer holidays. So brace yourself. But yeah, things have been well in Essex. So yeah.
Excellent, excellent. And the weather is turning. It's getting to that time of the year. So fantastic. Nice to see all smiles all around. And joining us today, we've got David. So do you want to introduce yourself, David? Tell us a bit about yourself.
Will do. Thanks, Jack, and thanks, Mark, for inviting me onto the podcast. So I'm the owner of a care business advisory service called Care Ideals. We've been running since the beginning of 2015. I registered the company in October 2014. And since then, we've supported about 125 different care businesses, domiciliary care, care homes, nursing homes, supported living. Our focus is, it's not just about compliance, CQC regs. It's about looking at how the whole business operates. If I go back a little bit, and then I'll bring you up to date to where we are now. From 2001 to 2014, I ran and managed psychiatric services, mental health services. I worked for Signet Healthcare for 9 years, give or take. Then I worked in North Wales for an organisation called Mental Health Care UK, which was part of the Castlebeck Group. And then I worked for the Priory Group for just under 2 years. In 2014, I decided I wanted to take the experience that I'd gained, lots of crisis management experience and developing hospitals and opening wards and closing wards and so on and so forth, and go and help smaller providers. But I didn't. My background was obviously healthcare, which was running hospitals. And I understood that I didn't have that kind of social care background. So I spent the next 6 months driving around the country, visiting care homes, nursing homes, dom care providers. Picked up my first client in January 2015. And then since then, we've supported, like I said, about 125 different care businesses. For the first few years, it was lots of crisis management work. Some compliance visits, but lots of crisis management work. Some of it was fairly short periods. Some of it was 6 or 7 months at a time of working 7 days a week, long hours, etc. And after a while, it became, I guess, quite disheartening in terms of what you would walk into in these crisis management situations, and how the staff were treated, how the residents were treated, the lack of care, and so on and so on. And it was, I used to wonder how a service could get to that point and nobody had realized. Because to get to that point, that doesn't just happen overnight. It's 1 year, 2 years, 3 years of dysfunction, and eventually it reaches a breaking point. But it concerned me about how it could get to that point without somebody noticing, whether it was CQC or the local authority or the owner or the registered manager, etc. How could it get to that point? And I'd also then looked at many smaller care businesses. They have a number of different suppliers, if you will. So they get their HR support from one company, marketing support from another, occasional, sometimes mock inspections, compliance visits, etc., and so on and so forth. And I thought, if you could get all of that support from one service, wouldn't that be much more effective, much more efficient, etc.? Because I looked at this from the perspective of what we had to do when I ran the psychiatric hospitals, where you were responsible for pretty much everything. And you didn't really have that in the smaller care businesses. That's why you had all of these different services supporting the care business. And many of those support services didn't come from a care background, and looked at things in a different way. Policies and procedures would be another thing that they got externally. And I thought if you could just get this from one source, this would be much more effective, much more efficient. And that's what we've been doing for probably the last, I'd say, 3 years, maybe slightly longer than that. And then about 2 years ago, having dealt with dozens and dozens of clients and dealt with different registered managers and so on and so forth, it was apparent that most registered managers got to that point via the care pathway. So carer, senior carer, deputy manager, registered manager. But many of them didn't have any managerial training, no leadership training. Some of them had done what they call regulated qualifications. And they said to me, it didn't actually help me. I've done it. I've got this qualification. It didn't actually help me. They had some of them didn't have a budget. They never got to see management accounts. Some of them said that they did get management accounts, but they didn't understand the management accounts. Some of them couldn't explain the difference to me between profits and revenue. Culture was another big issue that they didn't understand, couldn't comprehend, etc. And this varied from place to place, but it was a fairly consistent theme. And I thought if we could develop a solution that strengthened that layer of management in all of these smaller care businesses, a deputy manager, registered managers, and sometimes even owners. So you've got, let's say, an owner of a domiciliary care business. They worked in large NHS hospitals, general hospitals for 20 years. They've now decided to open up a domiciliary care service, but they haven't worked in social care before. They don't have any business qualifications, and they struggle as well. And I thought that layer of people, if we could support that layer and strengthen them and give them the skills and the confidence and the ability to be able to do that, to manage the business, because that's in effect what they're running is a business, that would massively support what they were doing, make it much more effective, much more efficient, help with staff recruitment, staff retention, help potentially drop the massive churn that you have amongst registered managers across social care, which in 22-23, according to Skills for Care, the turnover rate amongst registered managers was 23.2%, which is about 5,700 people every year leaving care businesses. And that's not taking into account either the number of registered managers, let's say in their late 50s, early 60s, who are going to be retiring in the next few years. And I know that 23% last year had come down to maybe 19%, but 19% is still a massive number of people leaving care businesses every year. And then you've got the effect of a care business not being with a registered manager or not having a registered manager for 2 months, 3 months, 4 months until they find a replacement. So looking at all of that, I thought a solution would be what we'd call our management development program. And that's 6 days spread across 3 months. It's 6 face-to-face days. There's assignments, in effect, homework that the attendees or the delegates do after each day. At the end of day 3, they get a big case study. So at the beginning, we split them into groups, depending on the number of people. Let's say there's 12 people. We would have 3 groups of 4. Those 3 groups would then do all of their group work during the face-to-face days together. The chair would rotate so that not one person wouldn't dominate conversation. They then get an assignment after each of those days. And at the end of day 3, they get this big case study that the individual groups have to work on together, and that they then have to present a minimum 45-minute presentation on the morning of day 6. And if I just run through quickly the 6 days, we've got cultural leadership is day 1. Day 2 is recruitment and retention in the morning, HR in the afternoon. You do days 1 and 2 consecutively together. Then a month later, you do days 3 and 4. Day 3 is emotional intelligence in the morning, and then role play, having difficult conversations in the afternoon. which is obviously the session that most people don't want to do because you know, manager, staff member giving the manager a hard time, but that's done as role play in front of other people. So, but it's the best way to learn about how to manage difficult conversations effectively. That is the end of day 3. Day 4 is social media marketing and business development. A month later is day 5, which is financial awareness and profitability. And then a month after that is day 6, which is when they present the case study in the morning, 45 minutes each. Each group and each person in each group has to do an equal portion. So if you've got 5 people, 50 minutes, it would be 10 minutes per person. And then the afternoon is running through everything that we've learned through the course of the program, and getting feedback from the attendees in terms of how they think they've benefited and how they think they're going to be able to learn what they've used in their career or in their roles going forward.
Oh, that sounds really comprehensive. Thank you, David. So I definitely agree that there is definitely a pinch point with a registered manager and a business owner. And I have referenced this many of times on the podcasts historically, how I personally believe most registered managers step in to the industry with the best intentions of supporting people and naturally progress with their career.
Yeah.
And as they climb up that ladder, they're taught more about regulation and less about business ownership and responsibility. And they come as bolt-on skill sets that the individual must learn.
Yeah.
But the individual may not have the capacity to understand them areas of business. And I always have this adage, which is social care gets the most bang for its buck for someone at a management level. You are essentially 5 roles in one person, but you're expected to know it all. Now, if you was to transfer that skill set into other industries, you'd be on about 5 times your salary. And this is where it fails as such, because the regulation is there to hold you to account of your social care elements that fall within the scope. But they brush on financial viability. But what's financial viability to someone who doesn't know how to manage cash flow? You know, so essentially, we look at all of the areas to provide the care and make sure that's successful, but we don't assess the whole understanding holistically for the business to see if the business is viable.
Yeah, 100%.
This is why we see so many startups and exits, because people start because they've seen a manager working or a previous business owner, but they don't understand the behind the scenes, the groundwork, and as you say, the social media marketing, the HR aspects, and all of these bolt-on skills that must be combined to run a successful business. And in the startup and entrepreneur world, I mean, as I say at the beginning, when you introduced yourself, you've worked for some of the large corporate groups where there has been a structure in place. There's a department to manage somewhere like payroll, you know. But when you're starting up and you're breaking out of your silo, about to venture out onto into the land for the first time, it's very scary because you're alone. Unless you have people like yourself giving that individual support and advice, people sometimes set themselves up to fail because they don't understand what's required beforehand. And then they will class that as a failure in a business when actually it's naivety of what's required to run a business in the industry.
Yeah, completely. I can give a couple of examples that would support that. So over the years, I've had contact from people saying, you know, I want to open up a domiciliary care business. And one of the first questions I always ask is, how much money do you have? And people have said to me, oh, I've got £10,000. And I've said, well, I can't help you. I said, I could take you through the registration process and I'll get you registered. I said, but you'll collapse in 3 months' time. You just won't have money. I said, you've got an office to think about. You've got staff who you need to recruit. You've got to train those staff, etc., etc. You've got to market the service. I said, 10 grand or 20 grand it's not going to help you. You're not going to be able to survive. And a couple of them have gone ahead. without support from me, they've gone ahead, and then 6 months later, you see the business has closed down. Because I would never, in that situation, I'd never say to somebody, "Oh, well, I'll take your money," knowing that they were going to fail. And it is, I think, in a way, naivety. I've had people phone me up and say, "Well, we got registered with CQC 2 months ago and we've had no referrals." And I say to them, "Well, did you make contact with the local authority whilst you were waiting to get registered by CQC through that application process?" "No, we didn't do that." I said, "Did you market your service, your business? Did you market that into the local community to potentially attract private clients?" "No, we didn't do that." So once again, it's business principles, that there's not this type of awareness of kind of, I need to do a proper costing in terms of the cash flow over the next 12 months, 24 months, whatever it is, because I'm going to be running at a loss for the first 6 months, 7 months, however long it's going to be, and plan that and have that on a spreadsheet in front of you that you can refer to and that can guide you. And going back one step is to even think, I need 45,000, I need 55,000, 65,000 to make this a reality. Or I deal with care homes, let's say, and the split between local authority and private clients is like 80% local authority and 20% private. And I talk to them and say, looking at your social media, your community engagement, this, that, and the next thing, what are you doing as far as that goes to try and get more private clients? "Oh, we don't do anything." Or they say, "Well, we do post on social media," and then you go and look at the social media, and it's fairly random posts about really generic things. There's no strategy behind it. Some of them have really poorly performing websites that they've built themselves that Google doesn't particularly like. It doesn't work well on mobile phones, and so on and so on. And all of these different elements factor into how the business functions. And it needs to be, it is a care business. And I've dealt with people who tell me that sales is a dirty word. And it's, well, sales isn't a dirty word. Sales is where your revenue comes from. That's what helps you to increase revenue, increase margins, help your occupancy to be at a consistently high level, help your weekly hours to continually grow, so that you're making profits, you can reinvest that back into the business so that the business can improve. And that was very much why I looked at supporting the whole care business and then also the management development program to help upskill registered managers so that they become more business managers than care managers. And when I say that, I'm in no way insulting what registered managers do. I really want to stress that. This is about helping them to become more skilled, more confident, etc., whatever it happens to be in terms of their role, so that they can run a more effective and efficient business.
I don't think that they would feel insulted anyway. I think that actually they're crying out for further training and development. And I think, like Jack has said, that actually we've spoken about it on the podcast. I think there's conversations happening within the sector around actually there is a complete lack of training and development for registered managers. And exactly what Jack said, that I don't think anybody comes into this sector to do a bad job. I think we kind of end up in roles of leadership and development and management roles because there's such a high turnover of people above us that you just naturally end up in those roles because you're really good as a carer, and then you become a senior and you're really good in that role, so you become the deputy, and then you're really good at that, then you become the manager. And when you were talking kind of when you were doing your introduction, so much of what you said kind of resonated within my career in terms of I was managing a care home. I'd had no training, I had no management experience, I had no budget training. I mean, and then when they wanted to make me the registered manager with the CQC were like, he has no qualifications and he's had no, we can't make him the registered manager. Like, he's got to do his level 2, 3, like, so they wouldn't register me. So I had to go away and do those qualifications. I mean, I do think there is an onus on registered managers, to be honest, around what training and development they need. I think there's an onus on organisations, to be honest. but also in terms of when they're advertising what they need. And I talk about my own experiences, like we've spoken around finances and budgets and accounts. I'm always honest in terms of finances are not my skill strength. They never will be. Ironically, I oversee multi-million pound contracts, but I've got, I work in a large organization and we've got a finance team and I've got managers underneath me that finances are their strong skill set. But also, I know if I sat in front of an interview panel and said finances aren't my skill set, I would be offered that job.
Yeah. Mm.
But I think that as organisations, we need to appreciate that actually I've got years of experience in social care, that I could do a bloody brilliant job at everything else, maybe not at your finances, but actually you've got other people in your organisation that can do a bloody good job at that would complement me in that. So I think we need to kind of, as society, pull on one another. And I don't think as social care we really do that good enough at the moment. I think we kind of still lean into what that job description might say. And I still think in social care, we're still very much reliant on what that job description says, which, as we know for social care, never actually fulfills what that job looks like. I bet if I went and pulled my job description now, it probably wouldn't even touch on what I actually do. And I bet if we look at registered managers, it wouldn't even touch on anything they actually do.
No,
This is
not at all.
exactly it, though, isn't it? Excuse me. It's like when you look at a registered manager CV, must have HR and recruitment experience, must have this, must have that, and it's like, well, hold on a sec. You're looking for 30 years experience of five different roles for someone who's 25 years old, onwards, who's just got, and that's where it's morally wrong. And I feel we could have so many different separate conversations and podcasts off the back of some of this content. I personally feel, because there's so many avenues that we're going to be able to, that we're not going to be able to tackle today. But you're absolutely right. The learning and development pathway is a significant element of a person's career.
Yeah.
And where they start now, they may wish to go on a completely different trajectory as they progress. A lot of people who start in care want to work in management. Then they do a couple of years and it's actually, I'd like to step into nursing. So their pathway trajectory changes and how they wish to go. But companies, when they're looking at retention, not just on the recruitment element, but if I've got, as Mark said, good individuals in my workforce who I can see, who are malleable, who wish to progress, have that hunger to move up the ladder, but also the acumen to come with it, it's worthwhile investing in them. And there are distance programs out there, for example, bookkeeping basic level ones, just to give a basic understanding of learning invoicing, expenditure, and baseline cash flow, because that person's baseline knowledge is a greater asset to the wider teams, especially in an enterprise level system. But ultimately, when we look at the individual, the person has to have the acumen. They want to learn. They need to be able to progress in that. And some people just plateau. They get to an area within their career and they stagnate because they feel, I'm in my comfy zone. And this is where I feel we look at a lot of technological advancements that are coming in now that take over a lot of the back end tasks. So we don't have to have such a reliance on an individual burning out, I personally feel that when we look at how this is in general, I think there is a crisis point that's underlying here with businesses, and it causes more to bust. And as you've rightly touched on, setting up to fail and making sure people have the right start there. If someone's told they can start a business with £10,000 in home care, maybe 15, 20 years ago, not 15, 20 years ago now. And this is an example of where information doesn't necessarily update in time, and people are trying to base things on historic ways of working. But in all fairness, I've really enjoyed this conversation so far, and I would love to bring you back, David, on another podcast if that's possible, because there's so many different points that we could talk about here.
I can talk about this over and over and over again about all different types of scenarios, and it's working in social care or health and social care. It's, for me, it's always been about wanting to make a fundamental difference. And, with the crisis management work, that wasn't making a fundamental difference. And the some of the providers that we supported, we got everything sorted, and then a year later, they called us again, oh, we're in trouble again. And it would be kind of, but we set everything up for you. Everything was in place that you needed, and now you've kind of gone back to that. And it's about making that like fundamental change that needs to be made, so that it's not same old, same old. It's about moving forward with the times and the ongoing changes, so that you increase in national insurance it's not catastrophic for you. It's an irritation, but it's not catastrophic. And understanding how social media can benefit your business, and even the cost of that training. If you think about training courses, and I'm not talking about your mandatory training online type of things, I'm talking about the management development program or similar types of services or courses. That cost, whatever that cost outlay is, £1,500, £2,000, whatever it happens to be, that cost will pay for itself time and time and time again. Because many care businesses, how they function now, they function, but it's not effective, it's not efficient, and it becomes a time cost. Because instead of being able to focus on the development of the business and innovation within the business and so on and so on, it's almost like every day is another crisis management day. And it's not always significant crises, but it's another crisis management day. So you're kind of in the here and now all the time, instead of being able to focus on what's the plan for the next 6 months, the next 12 months, the next 24 months, whatever it happens to be. It's focused on what's happening today, no opportunity to look at what's happening in the next 12 months, 24 months, etc.
No, that's
I think
brilliant.
you always remember the company, don't you, that always trained you well and developed you and looked after you as well. It's even though you might not necessarily see the knock-on impacts, I think you'll always be remembered. And I think you might not necessarily ever hear it, but I think as a manager, I always talk about the companies that have developed me and, you know, those organizations. I still talk about, like, to the staff in the company I work in now, actually, you know, actually when I worked here, they were really good at doing X, Y, Z, and I, you know.
And it's so interesting that you said that, Mark. I often talk about a guy, I won't mention him by name, but when I was working for Signet, he was a associate director for a specialized commissioning group, and he used to come to the hospital. He had a few patients there, and he would always ask me a question that I couldn't answer, and whatever it was related to, he had so much experience, this guy, but he would always ask me a question that I couldn't answer. And I could have, you know, said, well, you know, this is my hospital, you shouldn't be asking me questions like that, blah, blah, blah. But I thought, well, I can't answer that question. I'm going to go and find the answer. And over that probably 2-year period where I worked with him, he came to the hospital, let's say, every 6 weeks. I learned so much from that guy because he asked me questions that I couldn't answer, and I had to go and find the answer. And I learned so much from that. And I always, when I'm talking to people about my work history, I always talk about that. The benefit 16, 17 years later, how I benefited from just these interactions every 6 weeks or so has stood me in such good stead over the years.
I totally agree. And I'm going to sign off on this one because unfortunately we're running out of time. But there's always the imprint that I have from when I previously worked in the military before I stepped into social care. And love or loathe the military, the learning and development was there for people at all levels, and it helped shape me and gave me the trajectory I wanted and needed throughout life. And for that, I will always be thankful, you know, and I will always remember that. And having that good grounding helps you flourish in a career. And a lot of companies really need to reflect on how they induct and develop and retain their employees as they go along through the career. And using box check methods just does not work for everyone, and it doesn't help build a stable plateau a stable base for someone's career to plateau. But no, thank you very much for joining us, David. It's been an absolute pleasure, and I would love to have you back on here. We've got so many different points we can discuss. It's been really, really good podcast. Thank you very much for your time.
No, not at all. And thank you so much. I genuinely appreciated the opportunity, and I can talk about this topic and associated topics over and over and over again. Anytime you want.
That's brilliant. Thank you. Have you got any closing statements, Mark?
No, thank you very much, David, for joining. And I think anything to raise awareness of, operational managers having, any kind of learning and development. So yeah, thank you for joining us.
Thank you very much.
Thanks so much. Thank you very much.
You're welcome.
See you later.
Bye bye. All right.